I was working in the NHS for about 30 years, but I've probably actually saved more lives in my last 2 years here than I did in all the 30 years in the NHS.
I sometimes feel actually that I've gained more than I've given.
VSO logo says sharing skills, changing lives, and I would definitely say it's a two-way process.
Hello.
Who's that? You're from?
Dr. Richard.
The issues in terms of getting healthcare is that if you haven't got any money, it's quite difficult to get healthcare. If you haven't got any money, you can't get transport to get to healthcare. And if you haven't got any money, you can't buy the drugs to get better.
The main challenge of the health system is that it's understaffed. So very little nurses, very little clinicians, very little of everything in general, staff, but also equipment.
In the UK, I've been working as a district nurse for about 20 years. I was approaching a significant birthday with a 0 on the end, so I decided I had to think about what next. I think VSO has to be the right time in your life. You know, do you have elderly parents? Do your children need your support? The answers to those were no for me. So I thought, well, I'll just fill in the form and see what happens.
Just say 99 for me. Can you say 99, Leon?
99.
Good.
I didn't realise that VSO would want people of my age. In fact, I really thought they wouldn't. So I was a little bit tentative when I contacted VSO and said I'm an old git and I have reasonable health and these talents. Are you interested? And I really did expect them to say no, but was pleasantly surprised.
One of the major things I've been doing since I arrived here is re-establishing village health teams, and we have trained them in malaria, immunisation and reproductive health.
I think Pam's impact will stay with us for a long time. Wherever you go now, you see people giving testimony as to what she has served them, as if she is medicine herself. So I think she has had a very serious social impact. Physical, both mental, and I don't know how to describe her, but I think she's a wonderful person.
In some ways, being a community nurse in Uganda isn't different to being a district nurse in the UK. You're going out to visit people, you are trying to keep them well, and you are respecting and supporting them as human beings. And those principles are exactly the same. So if you like people and you can mix with people in their own homes, in their own villages, it will work for you here just as well.
Being a health worker in Masindi needs a lot of commitment, actually. It's so demanding because actually we have so many patients on the ground and so many diseases, and yet we are few.
I think exposure to other cultures is good for everybody, but I think particularly in the health service, as Britain is developing a multicultural society, it's very important that people realise that there are other ways of thinking about disease, there are other ways of thinking about health that are not always obvious.
I think it's absolutely key to have exposure. I just think unless you have, you just can't imagine what the difference in healthcare is.
I think that it's surprising what I will be taking back to the UK. Obviously there are skills about HIV and about TB diagnosis that I would have never developed in the UK. But there's much more an issue of flexibility, of dealing with problems and practical responses to problems, which you have to develop in Uganda.
As much as anywhere in the world, there are people suffering here. They need patient care, they need good care, they need good health care. And if you can help one patient a day, or you can pass one little thing on to a clinician or to a nurse, then you're making a difference.
I'd like to tell the doctors in England that, one, it's great to be in Africa, to come over to work with us, and Their expertise is really, really important. When they come over, they bring in new information and new ideas. Let them continue coming, yeah? We shall be happy to have them.
VSO volunteers that have come to Uganda and worked with us in this hospital have added great value to, for example, our nursing education, and they go back and leave something that we can work with. They leave people who have gained skills and knowledge from them and are able to implement things that probably they wouldn't be able to implement previously.
It's a very, very rewarding experience and a special experience. And if the time is right for you and you are the right person, it will work.